Hello, I'm Kevin Liu. Today is Sunday, February 9th, 2025. So, I know a lot of you are watching the Super Bowl stuff right now. Currently, the last thing I saw was the trumpets walking on the field. Updates on my situation. I somehow got a lot more views. Not sure why. YouTube seems to be boosting smaller creators, which seems cool. Um, anyways, other stuff. So I had a ton of appointments last week. I saw my neuro-oncologist, my neurologist, my physical therapist, my occupational therapist, and so on. Pretty much, my radiation oncologist, radiation specialist, basically a lot of, how much more can I say? GI doctor. I think that's the gastrointestinal or gastroenterologist. Wow. Yeah. There's a lot of doctors out there. But yeah, I saw all of them last week, and thankfully this week I only have three things on my plate. But what did I do last week? Let's see if I can remember. So the plan was to confirm that I would do a third round of radiation. It's going to be in a lower area. And the way my radiation therapist explained it to me was, radiation was targeted at the tumor, which tends to grow along, I don't know what the word he used was, to grow at a specific area that's basically like the superhighway of your brain. That did not sound very good to me, because if they take my superhighway of the brain, it's kind of hard to remove, right? But then he said something that was even more bleak, which is now it's spreading along the superhighway further down. So that's why we're going to have you do another round. But because it's farther down, it's not like they're radiating the same spot. So the overlap, let's say they radiated from here to here. Now they're radiating from here to here or something like that. So yeah, radiation again, not in the same spot, could cause same damage, potentially worse. But main objective is to stop growth, basically deactivate the cells from reproducing, which is pretty much, as my neuro-oncologist calls it, the best tool we have against brain cancer, or cancer in general. It's just radiation. The cancer itself is an error in its status. So if we radiate it, kill it off, it's less likely to reproduce. So I've agreed to do it. So they prepared a mask for me again. And what the mask is, if you are not familiar, is basically radiation is you get on this table, they put a mask on you that fits your face, and they use the mask as it's like a 3D mask, and they do markings on it, and because everybody's head shape is different, right? So they do markings on the sides, and they use the marking to align that area with coordinates. So like in school you learn, 0, 0 is origin, maybe 5, 5 is the center, and then 10, 10 is the edge. So maybe they need to radiate maybe 5, 8 or 5, 7, and then that's kind of how they line up the lasers, except it's in 3D and it's a human head, and if you make a mistake, you may paralyze me, make me unable to understand English, stuff like that. So no pressure. So last week, we were planning to do chemotherapy on the same day, called carboplatin. But my neuro-oncologist backed out of that. He was like, I'll have a meeting with you next week, this week. Next week meaning this week. I haven't scheduled anything with him yet. But he was like, if you don't want to do carboplatin, because it's a lot more aggressive, we have other options such as going back to doing Pembro infusions. Pembo's very common name is Keytruda. I've been on it before, didn't really feel too many side effects. And yeah, I'm really considering that, but he's probably going to come up with some other alternatives. But yeah, one of my things this week that we determined last week, my GI doctors or GI specialist, because they had to call an outside facility to do it. It's not with my primary care. Okay, so the Avastin I'm taking currently as an infusion can cause excess bleeding. So I've been noticing some extra blood from my gums, my teeth, when I have a bowel movement. So they don't know whether it's continually safe. Why am I saying this? Whether it's safe for me to continue before I get a scan or some kind of verification from the GI doctors that it's safe. So I talked to the doctors, and their only concern is, there's no pain. There's no like I don't seem to be having any large issues. So they're just going to do a CAT scan or CT scan of the abdomen, just in case I have thin blood or internal bleeding in this area. So that's one of the things this week. That's Tuesday. Yay. Um, the other things this week are physical therapy and occupational therapy. So basically just stretching and seeing how I'm doing in terms of mobility and coordination. As you probably noticed, or maybe not, I don't really know how much I move. My right arm is still screwed. Well, not screwed, I shouldn't say that, but temporarily impaired until further notice. It's kind of like a subway system, right? Like who knows when it's gonna work again? And the truth is, nobody knows. Just until next time. So I need to do constant stretches, and it feels like it's a lot of effort. Like I need to think about every motion. Oh, interesting thing. If someone, if you encounter someone willing to give you a muscle relaxant, that sounds good. It sounds great. Relax your muscles sometimes. This pill I took 5 milligrams of. I did this. I took it on Thursday because no. I take it the day before chemotherapy. So is it Friday? Anyways, let's say I took it on Wednesday, but oh yeah, I took the pill on Wednesday, and I was so sleepy. Like on Thursday, like some of my face muscles were like I didn't sound the same. I didn't feel the same. I didn't think the same. Well, already my thinking is pretty kind of slow, as you can tell. Maybe I should go back to like video 50 or like earlier, like day 50, and then compare my talking speed or like my thinking output or the way I word things, and I'm sure I can notice a change. But yeah, that drug was taken at bedtime, and I was supposed to like take it, get chemo, take it, and then take it again to prevent nausea and vomiting. But instead, I got like diarrhea, so I just spent like hours in the bathroom, and I was only taking it like one time without the chemotherapy and the rest of it. So I'm don't do your research, because I found out after I took the drug. And I found out that it's gonna take some time to get out of my system. But I feel better today. Like, I think the day after I took it, I was like completely like tired. I slept like half the day. Well, I sleep half the day anyways now because of my condition, and because I don't set an alarm. But yeah, that busy week. Yeah. So this week, maybe I get a schedule with my neuro-oncologist again to see some options I can do during radiation, or maybe waiting for radiation to finish. I'm not as naive about it. So the very first time I was like, oh, it's radiation. I'm young. I'm a lot younger than a lot of cancer patients. I'm certainly the youngest one in the room every time I have a meeting of some sort, or a doctor visit of some sort. So the first time radiation happened, like the cycle of radiation was like 30 days. I was like, okay, knocked it out of the park. Second round, I was like, okay. And then the second round gave me mobility issues. So yeah, I could make a whole nother video on that. Maybe I will. But it's like what I'm going through, or what I thought then and what I think now. Maybe that's a good idea before I start radiation. Just in case like I can't talk. So I wouldn't say I was scared, but it's kind of like the feeling I had. I know I made a video about it. I don't. It's not in the daily videos. I don't. Okay, so I know I don't make videos daily. I just had this habit of like numbering them daily. Like day 141 was like a week ago. So day 142, like I don't. It's just stuck now. Okay, I'm sorry. But anyways, it was kind of like surgery in a way. Or it should have been like surgery in a way, because when I had brain surgery, they put me under. They cut into my brain, and then I wake up, and then like this big question mark of, will I become a different person, or will I forget? I won't even know what I forgot because I forgot. You know, it's on the table whether I'm going to be able to talk, able to speak English, able to walk, able to read or write, like, just, yeah. But radiation is even worse because it's like, it's from radiation to the rest of your life. So it's kind of like you sign this paper acknowledging the risk, and it's like, you had radiation this time, well, maybe you develop something in 5 years or 10 years. Or you can be like me and you can develop some conditions in the next year or in the next month, you know. So that's kind of annoying. You don't know what you're gonna get. So I think I've talked enough for today, and I've sufficiently updated everybody on my condition as well as my weekly schedule. So yeah, I hope everyone has a good week. Go Birds. I know that the city would be destroyed anyways, win or lose, but yeah, go Birds. See you next week.